15 states are now reporting cases of measles. Texas remains the hardest hit with 223 cases, and health officials have linked cases in New Mexico and Oklahoma to the Texas outbreak. A 6-year-old girl in Texas became the first U.S. measles death in a decade. Health officials say she was not vaccinated. Well, many people have questions about this measles outbreak, so we have Dr. Susan Girois, director of the Norfolk Health District, with us right now to answer some of our questions. Thank you for taking some time to talk about, because a lot of people are talking about this.
Sure.
And the first thing that people think, well, I'm vaccinated, so how effective is this, and am I okay?
Well, the good news is the MMR, measles, mumps, rubella vaccine is very effective, one of the most effective ones we have. It's been around for decades and really has a great track record for safety as well as a great track record for efficacy. So it's 97% effective if you get your full 2 doses. That means of 100 people vaccinated, about 97 of them probably won't get the disease, or at least not severe disease.
You get that vaccine at what, 12 months? So if there is an outbreak or if someone comes down in your area with measles, should you get that vaccine a little bit earlier?
Well, most folks in this area, and the good news is we're a very vaccinated area. Hampton Roads has really done a great job. But at 12 months and sometime before kindergarten is when you get your second dose. And most of our kids, over 95% across Virginia and Norfolk Public Schools, probably over 97%, have been vaccinated by the time they're in kindergarten. So if kids, or even we're now adults, have gotten those 2 vaccines, we are fully protected for life.
Okay, because another question that people have is, well, should I get a booster? I was talking to one doctor earlier this week who said some of the baby boomers may need a booster because they got the shot back in the 60s and maybe they only got one, and it might not have been as effective. What do you say to that?
Yeah, I like that you're looking into that. It's a little bit complex, but the history is like this. Before 1957, there was no vaccine, and most folks, it's so contagious, most folks did get measles and therefore are protected for life. But there was a period between about 1963, 1968, where there was a different type of vaccine that was less effective. I would recommend that anyone who may have been born between 1963, 1968, that they certainly go and check with their provider if they should get another vaccine. They can do that by checking blood tests, they can do that by checking their vaccine records, but it's worth checking.
All right, and you don't look for this to be like another COVID pandemic, as some people, that type of an outbreak, because of the vaccination rates.
Yeah, well, it's not another COVID. It's not another COVID. We have a strong vaccine. Most of us are already vaccinated. It's not going to be the same thing. But I want to understand that there can be fear about that, and that's not something that should be taken lightly. Folks fear of having another pandemic and other vaccine mandates and all. But the good news is we're in a great position. It's a strong vaccine. Most of us are already vaccinated. So there may be pockets or individuals who haven't been or can't be vaccinated because of medical risks. And those need to take particular protections. Go see your doctor. There are things to do to protect yourself and your loved ones.
Thank you so much.